Hello, everybody, and welcome back to the Nonprofit Spotlight series. This is Grayson Harris, and today we are thrilled to be joined by Joanne Simons. She is the CEO of Northeast Arc, and we are just so happy to have her on the show today.
Thanks, Grayson. It's great to be here.
Thank you for joining. And if you could just set the stage a little bit and tell myself and our audience a little bit more about what the work is that you're doing out there.
Well, the Northeast Arc changes lives for people with disabilities. And we do that every day. And we do that from the beginning of life, from the moment a child is identified or born till the end of life, in about 28 lines of business. I like to think of us a little bit like Amazon. You go to the top bar and you have the drop down menu and what it is that you're looking for. I think somewhere in the Northeast Arc you can find it, but a little bit by the numbers, which sometimes makes it a little bit more visual for people to understand, is that we have 1,100 employees and we support and touch the lives of 10,000 people with disabilities and autism every year. And we do that in somewhat of a small region compared to the United States. We're actually in the northeastern part of Massachusetts, which is a large area population wise and a very impactful, innovative region of the country to be in. People may not know, but Massachusetts is the best place for people to live. It might be the most expensive place for people to live as well, but we have a outstanding educational system and medical system, and we now offer free vaccines and immunizations to anybody.
That is incredible. Thank you for that context. And a little bit more on that note, can you explain a little bit about what ARC nationally kind of is and what that kind of structure looks like?
So we're very fortunate to be part of both a statewide and a national structure that advocates on the state and federal level for policy that is inclusionary and fair for people with disabilities. So there are, over a dozen chapters in Massachusetts, as well as hundreds across the country. But each one of us is a separate 501(c)(3), and each one of us is governed by a local board of directors, and we can decide what businesses we are in. Some are small and grassroots advocacy, and some are large, very impactful in terms of a service delivery or as a provider of services. And we fall into both categories, both as an advocacy organization and a service provider, but look to our state organization as the leader, and that's called the ARC Massachusetts, to provide us with that thought leadership around policy and advocacy at the legislative level. And we look to the same leadership to the ARC of the United States for that on a federal level.
Thank you for that context. And you've been at the organization a little over 10 years.
That's right.
And change is a constant, right, within the nonprofit space. And especially this year, there has been a lot of challenges facing the philanthropic landscape. I would love if you could tell me a little bit more about some of the changes that you've seen within the organization and also the needs of your community as well.
Well, the needs continue to grow because we know that there's people with disabilities who are identified every day and families who need help every day. The context of the times that we're in is a little challenging to predict because we changes by the day. But we do know that in Massachusetts alone, there's thousands of people who are in danger of losing their safety net in healthcare, and that's Medicaid. And we know that there are people who are in danger of losing food stamps, which is the SNAP. And that affects people and families with disabilities. While we haven't been directly affected yet by some of the cuts that other organizations that receive direct federal funds have been, it really impacts our employees in ways that people may not even realize. That a large number of our employees, and it may even be a small majority, are people who are new arrivals to this country, all have legal authorization to work. They're all permitted to work here, yet they are facing some challenging times of whether or not they're going to continue to feel welcomed and embraced by the United States. They are often the lower paid workers. I'm not talking specifically about the Northeast Arc, but sort of the immigrant workforce, and rely on things like food stamps too, and the safety net of healthcare and housing subsidies. So not only are we worried about what may happen that could affect our ability to support the individuals with disabilities, and that's our mission, but we can't do the mission without our staff. And we are very worried about the possibility that our staff are going to continue to feel increasingly vulnerable in this environment. And so we will be watching and helping and assisting them in any ways that we.
And what does that look like in terms of being able to create that assistance within your organization? But and then also, what would you ask, of the more broad ecosystem around that? What can
Well,
leaders do?
we're hoping that our leadership will, extend the Affordable Care Act, which will allow families to continue to receive health care and affordable health care. That's what the word was, the Affordable Care Act. And of course, it started in Massachusetts under, Republican Governor Romney, which sometimes people forget that it was actually initiated under his administration, which we're very proud of in terms of access to health care. What it will look like for some folks is that their immigration appeals, for example, or their immigration applications may not be acted on in a timely enough a manner for them to allow to stay in the country. They may not have the same pathway that had been offered to them, if they were dreamers, for example. I have to figure out a way to keep my lights on in here. I'm sorry.
Oh,
That
you're
was a
okay. And we can
temporary.
we can always, do like a quick cut there too, so no stress.
Okay. And, many people rely on, the SNAP program, which, was formerly known as food stamps.
Mm,
So if those get eliminated or reduced in any way, not only does that affect our workforce, but that affects people with disabilities who are living independently.
of
My
course.
son
Yeah.
relies on food stamps and Section 8 housing voucher and, fuel assistance. Receives Medicaid as his one of his healthcare plans. These are all stools of a very large table that
Yeah.
need to actually all be intact and working in order for us to be able to continue the level of services that we have. So we're prepared for the ripple effect. We haven't seen it yet. And I want to make sure that people aren't thinking in a hysterical manner that, the sky is falling. And I'm really confident that even if that day happens, we're going to be able to figure it out. I've been around for a number of decades and we spent months preparing for a swine flu epidemic that never happened. And months, I mean, we had, 5-inch binders of what we were going to do in Y2K, which some listeners may not even know, but that was when we went from 1999 to the year 2000. There was a prediction that the whole sky was going to fall down and satellites were going to come crashing to the earth. We spent months preparing that. Nothing happened. And then COVID hit. And in 48 hours, we had it figured out. We had no warning. We had no preparation, but we know how to respond in a changing environment. And so I know and I have great confidence that we'll continue to be able to do that if, in fact, we have to make changes. And in the meantime, the work we do is so
Mm.
important that we can't ask people to spend time planning for contingencies that we don't know will exist.
Thank you for that. I think that's a really powerful way of approaching that idea, right? And the mission and impact is that important that you need all hands on deck, to really support the needs of your community. And I would love something that we talk about a lot on the show is this idea of connecting the needs that you have within your organization with the values of both your donors and also community partners. An example that I've seen within your organizations a partnership between yourself and the YMCA in terms of these swim lessons. Can
Right.
you tell me a little bit more about what that program looks like and your philosophy around kind of matching values of like-minded organizations with the needs of your community?
Thank you for that opportunity, Grayson, because you led right into something that's really important. The Northeast Star can't do everything for everybody, but we have partners in the nonprofit and the philanthropic community that can actually, together, we can do everything for anybody. And a great example is that the leading cause of death among children with autism is drowning,
Mm.
and they're attracted to water and they often wander. So those two things are really tragic. And every single summer, we see here in Massachusetts and throughout the country children with autism drowning. So rather than just sitting back and thinking, well, that's too bad, what can we do about it? We know that the YMCA's are heavy in it. We've actually invested with the YMCA the North Shore here, and we've given them money to start a program called WaterWise, which actually has trained people around teaching children with autism to swim. So then we thought, what's the next way we can partner our values with the community? So we have a donor who has been very generous to us. And we decided that every child in our early intervention program, and we serve about 500 children a year, would be eligible for free swimming lessons. But we're
Mm.
not going to provide the swimming lessons because that's not our mission. But the YMCA's, that's their mission is to keep, healthy bodies, healthy families, healthy
Yeah.
kids. So we partnered with the YMCA's who we already have had long-standing relationships with. And the YMCA's in our area probably have 11 or 12 different swimming pools. So families can go and take this free opportunity to any place that they would normally go. And we're also then in doing that, strengthening a partnership, but building upon the strength of the
Mm.
YMCA's to be able to deliver high quality swimming lessons. And it's
Thank you for that example. I think it's an incredible showcase of the creativity that really goes into really solving the needs within the nonprofit,
and
space.
I have another great example. The
Okay.
city of Peabody, about 8 years ago, decided they wanted to have a downtown coffee shop. They had done a survey among the community members, and they said we want to like a nice, friendly, like what you saw in Friends. The place where people came together. They weren't looking for the big name stores, so they came to us and said, "Would you open a coffee shop?" And we're like, "Well, that's not really in our mission, but." Wait a minute, we can make it our mission because we can use the coffee shop to train people with disabilities for
Mm.
jobs in food services. So we've opened a coffee shop on the main street in Peabody. And as a result of our coffee shop, it was the beginning of a revitalization of the entire downtown. And the mayor of Peabody, Ted Betancourt, if you ask him, he will say, who would have thought that Northeast Arc would have saved downtown Peabody? Because we were the first new commercial business that went in and saw this. Now, it's been an incredible success for us because we've trained about 30 people and we've placed them in jobs. It's not a coffee shop where we have a few people with disabilities working there all the time and you see the same people. Our job is multifold. We are now supporting the community, places like Starbucks and Dunkin' Donuts and other food service places that need trained workers. And during COVID, we were the only ones still doing training. We were the only ones that could actually help them with a
Yeah.
obviously they had other recruiting areas.
Understood.
But we
Yeah.
also have this community coffee shop where we have a pay it forward board and people can put, a breakfast sandwich, a lunch sandwich, a drink, and somebody can come in really easily, take the little the yellow sticky and give it to the cashier without any conversation, know that we're nourishing and helping our neighbors who may be falling on rough times. So we're helping the city of Peabody, we're helping the neighbors of Peabody, but we've helped ourselves because we've trained 30 people. The project is called, the name of the store is called Breaking Grounds, but it's not breaking even. So I urge any of your listeners who ever find themselves in the North Shore area to come to Breaking Grounds and have a
Hey.
wonderful cup of coffee, which I know best in class. That's two examples of how it's really important that to me that the Northeast region of Massachusetts is the best place for people to live. Because if it's the
Mm.
best place for people to live, it's going to be the best place for people with disabilities and their families. It will be good for seniors. It will be good for young families. It will be good for LGBTQ. It will be good for everybody if we look at
Yeah.
it from a holistic lens. And the partnerships we have are just they're in the hundreds.
Thank you for sharing that. And for our nonprofit audience that's looking at these two great examples, it really shows the creativity that I think goes into this collaborative process within the nonprofit space. What would be a piece of advice that you would give them to really foster that creativity within their organization to
Well, we
create these unique partnerships?
So I think one of the things is to think about things in a way of how can we positively disrupt what it is that we're doing. And it may be as simple for some organizations to look at workflow. How can workflow become more efficient? But what is the community? I like to think of what does the community need and how can our mission match that need? Because if we're all going as nonprofit organizations to the community with hands and hearts out saying, this is what you need to do for us. But we need to be seen as an integral part of the community meeting the community's need, and that's how we've shifted it. Part of it, I think the other advice I would give is to be impatient. There's nothing better than impatience in terms of being able to make decisions and move forward. And, to be truthful, I'm also very competitive. So the two things, they were helpful to me as my youthful career in competitive swimming, but they've really become useful as how I look at how we do business is that nothing makes me crazier than to think that people are waiting for 100% consensus. You'll never get it. You'll lose every battle, no matter if it's on the battlefields, of the military or, the battle that you're trying to make a decision of where to go to where a family of 6 should go to dinner, for example. You know?
Understood. Yeah. Thank you for that. And as we look to the end of the year and to the future for your organization, what's on the horizon? What's got you excited?
Well, what's excited is that, and still with the uncertainty that's going on, that we're looking to actually bring the next sort of disruption, which is to see how technology can be used to supplement or supplant our workforce because we know that our workforce needs are tremendous and we have technology that can help bridge that gap. So we're looking at actually doing some additional work around remote monitoring in what was 24-hour settings and seeing if we can use 8 hours of that can be remotely. I'm also really excited about how AI might be able to
Mm,
help us with some of the tremendous need for some, for example, for, behaved ABA services, which are applied behavioral analysis services for kids with autism, which are done by board certified behavior analysts, of which there's a shortage of. But I think that we're going to see that AI will be able to play a role in that in ways that it freaks people out now, but it doesn't freak me out now that I've gotten to know really how AI could be positively used. And we need to make sure it's positively used and it's not just used to generate fake videos on Instagram.
understood. And for our audience that's tuning in, how can they get more involved both with your organization and also their local communities or art?
Well, if they can always reach out to me at the Northeast Arc, and you just Google Northeast Arc or Google Joanne Simons, and I'll put you in touch with who you need to know. And I just wanted to make one last sort of plug for something. So,
Yeah.
how technology has really changed. About 15 years ago, I wrote a book on the Down syndrome transition handbook, and it was in print and it did really well. But during COVID, the publisher went out of business, gave me the rights to the book. I found a younger author who could provide a much more current spin, and we rewrote the book. It's now online for free, and it's a downloadable Kindle book. So,
Okay.
just in that short time between it being published and then republished, we wouldn't have thought about it be having a website for it, download it, and make it. And we actually we could have sold it, but we wanted to make it free. It's our contribution to the community. So,
Incredible. And what's that book and how
it's
how
called the
can
Down Syndrome Transition Handbook. They can go to down syndrometransition.com, and it's not unique to Down syndrome. Any family could use it, but the original editor said, "Let's use Down syndrome or autism in the title." And of course, I had a son with Down syndrome, so I knew that it would feel more genuine for me. But
yeah,
I've had families of kids with autism, and then families of typical kids saying, I wish I had this for my typical."
incredible. Well, Joanne, thank you so much for coming on our show
Thanks,
and
Jason.
speaking to our audience about the incredible work that you're doing out there with the Northeast Arc and also for the national community as well. Thanks again.
You're welcome.